ClarIDHy is a randomized phase 3 study looking at patients with advanced cholangiocarcinoma who failed the standard chemotherapy but also carrying the IDH1 mutations. They will be randomized to receive the IDH1 inhibitor ivosidenib versus placebo. And this is actually a randomized phase 3 placebo-controlled trial. In this study, we did actually allow the crossover for the study design. So for patients who randomized to receive placebo, at the time of disease progression, they have the option of crossing over to receive ivosidenib. So the primary endpoint for our study was actually progression-free survival. But the secondary endpoints included overall survival, overall response rate, quality of life measurement, etc. And we have previously reported the primary endpoint, PFS improvement in earlier conference. And in this study, with additional longer follow-up of more than 1 year, we report the final mature overall survival results along with the PFS and also safety profile, as well as health-related quality of life outcome. So in this study, in this presentation, I will be reporting the median overall survival data from the ClarIDHy. I think with the longer follow-up, despite the crossover rate at approximately 71%, we were able to observe a numeric trend of improvement with ivosidenib in comparison with placebo. So from 7.5 months in the placebo arm to 10.2 months, 10.3 months in the ivosidenib arm. And there was definitely a numeric trend in the intent to treat population with a hazard ratio of 0.79 and p-value 0.093. And moreover, when we use a commonly accepted statistical analysis, and also this is a pre-specified statistical analysis, and this is the so-called rank preserving structural failure time, RPSFT. And so this analysis will allow you to correct the crossover. And so when we actually perform this type of analysis, and the median survival for the placebo arm was actually at 5.1 months. So the improvement for overall survival was definitely even further improved with this type of analysis, reaching a hazard ratio at 0.49 with a p-value of less than 0.001. In addition to the overall survival data, we were also reported the PFS as well as safety profile, which is consistent with our earlier presentation. But also we reported the updated health-related quality of life data showing that for certain subscales, particularly physical functioning, pain, and ivosidenib treatment actually preserve these subscales and in comparison with the placebo control arm. And so I think overall, the improved overall survival benefit along with the PFS benefit, and also coupled with the favorable safety profile, as well as improvement for quality of life definitely, this is definitely a highlight that we may actually be able to provide another good treatment option for patients with advanced cholangiocarcinoma carrying the IDH1 mutation.